This is Stefan Nilsson, a Swedish composer and musician. On the 17th of February 2023, he was diagnosed with ALS, or Lou Gehrig's disease, a terrible disease with only one possible end, an undeniable suffering and death. Stefan died only a couple of months later on the 25th of May after having voluntarily consumed a deadly cocktail which he himself had ordered. Afterwards, a criminal investigation for manslaughter was assembled. But would we say that whoever provided this deadly cocktail did something immoral? Did they not help him to relieve his suffering? Active euthanasia, or active mercy killing as it's also called, is illegal here in Sweden. But should it be? As of 2024, these countries have legalized active euthanasia under specific circumstances. But should active euthanasia be legal? And if so, under which circumstances? Stefan's case might seem very reasonable. A man suffering from a horrible disease that leads to nothing but death. But consider a scenario where a child is born with a severe disease that guarantees only suffering and a very short lifespan. Should assisted suicide be performed in such a case? The subject of euthanasia is an important topic which we ought to discuss. Should we assist people to end their life if they wish? And should we even assist those who cannot make the decision themselves? Many questions, so let's get started. In this episode, we will discuss the three most popular schools of ethics and explore their various views on this matter. This is a very complex topic, so I will only provide you broad strokes of how these different schools of ethics might reason on this matter. But to begin with, there are two very different circumstances under which one can perform euthanasia: active and passive. Passive euthanasia is to terminate any life-supporting medical aid, and this is legal in many countries. Active euthanasia, on the other hand, is not, and it is, as you can tell from the wording, actively performing a procedure which will end a person's life. According to utilitarian philosopher Peter Singer, there are three types of euthanasia. Let's distinguish them, for they have different moral statuses: voluntary, involuntary, and non-voluntary euthanasia. If an adequately informed, mentally stable person voluntarily requests to end their life, and it is carried out by a legitimate party, we have a case of voluntary euthanasia. Now, should voluntary euthanasia be legal from the standpoint of utilitarianism? According to classical utilitarianism, one should always aim to maximize pleasure and reduce pain. So, if a person is in pain and wants to end it through death, then we should simply aid the person in ending their suffering. Another version of utilitarianism is called preference utilitarianism, and it suggests that we should always maximize the fulfillment of preferences. If someone has a preference to die, we should aim to fulfill this preference according to this view. All this, of course, should only be done when all the necessary and sufficient conditions are met. So according to these two ethical views, voluntary euthanasia should be legal. But what about involuntary euthanasia? Involuntary euthanasia occurs when a person who is capable of consenting is killed to prevent suffering, but either actually have a preference to stay alive or is never asked whether they want to be killed or not. Genuine cases of this type seems to be very rare, thankfully. More or less, every case of involuntary euthanasia cannot be justified, especially from a preference utilitarian standpoint. If a person has, no matter the suffering, a preference to stay alive, then we should satisfy that preference. However, a strict classical utilitarian could argue that if a person refuses euthanasia despite impending extreme suffering, performing the act could still be justified in order to reduce suffering. This is indeed very paternalistic, so maybe preference utilitarianism is better. What do you think? The last one is non-voluntary euthanasia, and it is when someone is unable to understand a choice between life and death, and is therefore unable to provide an answer. Cases like these are numerous. People who have been through bad accidents, illnesses, old age, and also indeed a very controversial topic, heavily disabled children. Yes, we're talking about infanticide, killing of babies who are suffering from horrible diseases and disabilities. Let's discuss this a bit further. To decide whether non-voluntary euthanasia in such cases is permissible or not through the lens of utilitarianism, we need to understand the difference between two different perspectives within utilitarianism. Let's discuss this from the classic utilitarian standpoint. As mentioned, utilitarianism aims to maximize happiness and to minimize pain, but within which time frame are we talking? Here we have two different views. The prior existence view and the totality view. According to the prior existence view, we should only aim to maximize happiness and reduce pain for beings who exist now. But the totality view, on the other hand, argues that we should also include individuals who will exist in the future. As you might expect, the moral statuses of actions will change drastically depending on which view you endorse. I believe this to be a pressing issue for any type of consequentialist ethic. Let's work through an example. Let's say that a child is born with a horrible disease that will cause immense pain and suffering, and that the child will not live past his or her 5th birthday. In this case, it does not matter whether one favors the prior existence view or the totality view. The classic utilitarian conclusion is that we ought to perform euthanasia in this case. But a divergence may arise when we discuss more complex cases. If the child instead is born with a disease that will only significantly decrease the child's prospect to a happy life, we might get different answers. On the prior existence view, we should not perform euthanasia in this case, because we do not know whether or not the child's life will be worth living. The child might find happiness in spite of all the pain. But according to the total view, we cannot reach a verdict on this information alone. If, let's say, that the parents decide to perform euthanasia on the sick child and then afterwards go on to have another healthy child. If we count on the total prospect of happiness in this case, euthanasia can be justified. And then, if we discuss other cases of non-voluntary euthanasia, it seems permissible through utilitarianism, no matter the time frame one is endorsing. If a patient has fallen into a vegetative state from which we know that he or she will not recover from, euthanasia seems justifiable. She neither possesses prospects of any future happiness and probably any preference to either stay alive or die. Therefore, she is not alive biographically, meaning she does not possess an idea of herself surviving through time, which is the definition of a person according to Locke. But I have to mention that the relatives view should also be included here within the calculation. If a relative's happiness is reduced through the act, one might have to refrain from the act. But we can safely say through the lens of utilitarianism that Stefan Nilsson's case, which would have been a case of voluntary euthanasia, should be legal. But what does virtue ethics say about this matter? Aristotle is commonly seen as the father of virtue ethics, and justice was one of his cardinal virtues. In the Nicomachean Ethics, he discusses whether one can treat oneself unjustly and whether if the act of suicide could be such a case. He concludes that it is not, since if the act of killing oneself is voluntary, then the harm is consensual. However, Aristotle still thought that suicide is a wrongful act towards the state or community one lives in. It seems that he does not specify why though, but if the person would only be but a burden to the state or community and wants to be killed, it would probably be hard to say that it is a wrongful act. Virtue ethics also highlights the well-balanced life. One should act rationally in accordance with virtues. Several virtues could be involved here from both the patient and the caregiver's perspectives. Wisdom, to fully understand the situation and weigh all facts to make an informed decision. Courage, to face the facts that euthanasia might be the best option in some cases and have the courage to perform the procedure, both from the patient's and the caregiver's perspectives. Compassion, to see that the patient is in pain and suffering and act accordingly. Compassion was not one of Aristotle's cardinal virtues, but a modern version of virtue ethics is even called care ethics, which views care as the most fundamental idea for understanding morality. I am no expert on care ethics, but I believe that euthanasia must be part of it. But what would Kant say about euthanasia? Kant, in fact, was heavily against suicide or ending of a rational being, and voluntary euthanasia is, essentially, assisted suicide, and therefore wrong. But why did he think so, and does it necessarily follow? According to Kant, there is a practical contradiction in the act of suicide. You are using your rational agency to destroy that very rational agency. If you never had the rational agency, you would never be able to use it to destroy yourself. And also, if you universalize the maxim of suicide, i.e., everyone performs suicide, sooner or later no one will be left alive to perform the maxim. Ergo, suicide is wrong. And also, Kant thought that suicide is treating oneself as a means to an end rather than an end in itself, which is a core element within Kantianism. You should always treat yourself and other persons as ends in themselves. This might seem incredibly harsh, but does it necessarily follow? Fortunately, thanks to modern scholars, Kant is not seen as the harsh dogmatic philosopher who was against all forms of suicides anymore. And it seems that had Kant lived today, he would not have been against all forms of suicide. Because Kant also put a strong emphasis on preserving human dignity and rational agency. Today, there are terrible diseases that can lead to horrible deaths and the complete destruction of human dignity. Denying euthanasia to someone who requests it, letting them rot away in a hospital bed only to die in agonizing pain, does certainly not improve their dignity. And there is another curious case. According to Kant, if a person is wrongfully convicted of treason and must choose between capital punishment or enslavement, Kant actually thought that the person should choose capital punishment in order to preserve their moral agency and dignity rather than a life in enslavement. Therefore, one can argue that the same applies to a person who knows that they will lose their rational agency due to a terrible disease. Just like Stefan's case. These different cases, at least morally, seems identical, right? Although I would not say that we have a duty to end one's life in such a scenario, but it should be seen, at the very least, as a permissible act. One of Stefan's last wishes in life was that everyone ought to have the right to choose over one's own death. Hopefully I made this debate justice. Rest in peace, Stefan. So with all this being said, should euthanasia be legal? What do you think? Leave a comment down below and please be respectful to each other. That was a rough episode. I must admit that I got a bit emotional doing all the research on this heavy topic. Oh well, thank you so much for watching, everyone. Take care. I'll see you guys soon.